Iron is an essential micronutrient, especially during periods of rapid growth such as childhood, adolescence, and pregnancy. It is also an important nutrient for females who menstruate. The primary function of iron in the body is to transport oxygen in the blood to the tissues. Iron is involved in the electron transport system that controls the release of energy from cells. It is also required for the production of red blood cells and neurotransmitters. Iron is an important cofactor required for a number of essential cell functions. There are many factors that determine the proportion of iron absorbed from foods. It depends on the iron status of an individual as well as the iron content and bioavailability. Iron can come in two forms, heme or non-heme, with heme iron being more bioavailable to humans than non-heme iron. Absorption of non-heme iron can be improved by combining it with enhancers such as vitamin C. It can also be inhibited by substances such as calcium, zinc, phytates, and polyphenols. Iron deficiency is one of the most common nutritional deficiencies in the world. When iron losses exceed absorption, initially iron stores will deplete, resulting in a reduced ferritin level. When iron levels are low for a long period of time, the synthesis of hemoglobin and red blood cells is limited due to insufficient iron supply, resulting in anemia. Iron deficiency and anemia are associated with symptoms such as fatigue, weakness, impaired aerobic capacity, adverse pregnancy outcomes, impaired immunity, and brittle nails. Although iron is an essential micronutrient, it is toxic at high levels. Excessive iron intake may cause deposition of iron in the tissues, causing damage. Hemochromatosis is a genetic disorder that causes the body to absorb more iron than usual, which can result in damage and disease such as heart disease and diabetes. The RDI for infants aged 0 to 6 months is 2 milligrams a day. This recommendation is for breastfed babies. The iron in formula is much less bioavailable, so the intake of iron for formula-fed babies will need to be significantly higher. The RDI for infants aged 7 to 12 months is 11 milligrams a day. At this stage, infants are starting to eat solid foods. Babies that are fed more of a vegetarian diet will need high intakes of iron. The RDI for children aged 1 to 3 years is 9 milligrams a day and increases to 10 milligrams a day for children aged 4 to 8 years. The RDI for 9 to 13-year-old boys is 8 milligrams a day. It then increases to 11 milligrams a day for ages 14 to 18. For adolescent females, the RDI increases from 8 milligrams a day for ages 9 to 13 to 15 milligrams a day for ages 14 to 18. This large increase is due to the fact that menstruation usually starts around age 14. It is also recommended that adolescents that follow a vegetarian diet consume higher amounts of iron. The RDI for men stays at a constant 8 milligrams throughout life from age 19 and beyond. The RDI for women aged 19 to 50 is 18 milligrams a day. This high intake is to compensate for menstrual losses. The RDI for women aged 51 plus lowers to 8 milligrams a day, the same as men, due to menopause. The RDI for women aged 14 to 50 who are pregnant increases to 27 milligrams a day. Adequate iron levels during pregnancy are essential for the developing fetus. Iron-deficient mothers can put the fetus at risk for compromised learning and memory capacity. It can also cause low IQ levels as well as behavioral problems in children. The RDI for breastfeeding women is 10 milligrams a day for 14 to 18-year-olds and 9 milligrams a day for 19 to 50-year-olds. These estimations assume that menstruation does not resume until after 6 months of exclusive breastfeeding. Iron is an essential nutrient that has many health benefits in the human body. It plays a vital role in oxygen transport and other cell functions. It is a crucial micronutrient during times of rapid growth. Adequate stores of iron is vital for proper growth of the human body and maintenance of overall health.